I like that this is episode number 360, and I tried to come up with something clever to say about episode 360. I couldn't come up with anything, but that's okay. I've been a guest on 5 different podcasts over the last 6 months, and I have some pretty strong takeaways on this episode that I'd like to share with you. I think it will be very helpful for a lot of you. You're listening to the PHEC podcast, episode 360. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. Now, if you are brand new to this episode, welcome. And if you're a returning listener, I really appreciate you for tuning in and for following this podcast. My name is Dr. Charlotte Huntley, and I'm your host. I would like to briefly introduce myself or reintroduce myself, and then we'll dive into the topic that I have for you on this episode. Now, I am a public health entrepreneur. I lead a public health epidemiology consulting firm with a strong but small and mighty team of professionals who support me, and we all together support our clients. Our clients are typically large nonprofit organizations and sometimes a government agency. They are all sincerely interested in supporting and serving BIPOC communities. So that means Black, Indigenous, people of color communities. We are often invited to support tribal organizations, and we're always honored and sincerely excited to be able to do so. Now, we help our clients communicate their data, their health information in plain language to the communities that they serve. And sometimes that looks like the internal teams within these organizations. And then other times it's directly into the communities that they're serving. So at either way, we're really happy. How we show up looks very different from organization to organization. It just depends upon the needs of that organization. Sometimes it's helping with developing fact sheets or toolkits or a variety of reports, sometimes community health profiles, podcasts. So it just depends on the needs of that organization. If this is something that your organization is interested in, or you've heard the chatter around the need for something like this, then please reach out to us and just let us know. Give us a little bit of information through our website. If you go to DrCHHuntley.com and click on consulting, there's a form there. You can share a bit about your organization and what your needs are. And we'll be happy to arrange a time to meet and discuss. Okay, on this episode, like I said, this is just you and me for a little while. I actually have something I want to share, inspired by a series of podcast interviews where I was the guest on, I think, about 5 different podcast episodes across the first 6 months of this year. I've enjoyed it. It's been really nice. And each show, each host has a slightly different take in a set of questions and how they approach the conversation. And their questions for me has actually brought out a slightly different conversation each time. So they've been able to pull out different parts of my story in different angles and kind of different things in each of the conversations. So if you happen to have listened to any of those episodes on different podcasts, then you will have heard something slightly different about me in each one. I guess we'll provide links to those in the show notes in case you haven't heard them and you're curious, or these are also podcasts that I would, recommend that you explore depending on, your interests, but we'll provide those links in case you're interested. But what's happened is I've been really thinking about some things, especially with the most recent interview. It was an interview and a conversation with my business coach, and she really had me, because we've worked together for about a little over 3 years. And she really knows my business and she knows me and she's been on this path with me. And it really had me going kind of deeply on the growth and some of the conversations and just kind of reviewing and thinking, reflecting on things. So something that I really want to share with all of you are some of the takeaways. And I have some notes here, and these takeaways are not in any specific order, but I do think that it's important. This is like the first one. I think it's really important for us to share our journeys with students and early career professionals, but especially students. When thinking about the climate, the temperature, the state of public health as a profession, we lost a lot of our workforce during the pandemic. And there's a lot of conversation around that and some people that cover it on an expert level, but we all can agree on that. That's kind of common information, common knowledge in our industry. The way I'm thinking about it here, when we have students who are choosing to go into public health as a profession, I think it's important that we embrace them and we support them as much as we possibly can. So one of the things that I think we can help, and I've heard this over and over and over across the years, is sharing our journeys with students helps them so much. They get to see what's possible for them beyond what's enlisted in a textbook or in the syllabus or what's taught in in the academic setting, but they crave those journeys, they're hearing those stories. There's this pressure to know what you want to do and have it all figured out and fit in a category coming out the gate. And we need to remove that from them, especially as we're looking to rebuild our field and our industry. I think we need to support students that are choosing to come in this direction, support them and take away some of that stress to have it all figured out right at the beginning. Because not only from my podcast interviews where I was a guest, but if you've noticed on this show this year, we've been bringing back guests on the show that we've had that we recently or that we initially interviewed years ago. A lot of them were interviewed before the pandemic. So like 2018 and 2019. And if you go back and you listen to those interviews and listen to what they shared about the work they were doing at that time compared to their updated episodes this year, fast forward several years, and you're hearing something different from every person. All of them have pivoted in some way. And that's the nature of progressing and going on this journey. Public health is broad. So I really would love for us to remove the stress of having for the students and these recent graduates to have it all figured out, because all of us have pivoted. I'm speaking to all of us who've been in the field. You've been in 10 years or more. Think about how much you've changed over that period of time. So sharing journeys, which is what I've been able to do on this podcast, is really important. So even if you go back to some of the older episodes, so the audio quality might be a little different. The people are different conversations from different people, no matter what work they're doing, hearing how they started when they first learned about public health, what they were interested in then, what they're interested in now, the work they're doing, what they would like to be doing, where they're going, and the advice that they share for students, especially in the older episodes that I have on this podcast. Regardless of where those people are now, that snapshot in that time is really relevant. That's still high value for students. So I really encourage all of you to think about ways that we can help share more journeys. Now, there are a lot of other podcasts in public health that do the same, that do something very similar, where they're interviewing guests and they're talking about the career journey and they're sharing resources for careers in public health. And I think we need to share these podcasts and these episodes they're all free resources. And these are ways that we can help the students and early career professionals feel more aligned. They can connect, they can hear. I know with my podcast, you can listen to a guest, and if something about that person resonates with you, their contact information, at least like their LinkedIn links, are provided in the show notes. And that's a way that you can reach out and say, I heard you on this podcast and I liked XYZ about what you said, or that resonated with me because of ABC. Whatever it is, you have an easy way to connect with someone after listening to them on the episodes. So I really encourage all of us to think about ways that we can help sharing. And I'll share at the end of the episode how we can easily share this podcast with other people and especially with students. But that is something that, I really my coach even said that, like, we need to stop asking, she said, we need to stop asking children what they want to do when they grow up, because it's a lot of pressure. And how could they know when they haven't even experienced enough to be aware of what's really possible for them out there? So it just had me thinking about how we can support public health students and folks that are interested in this industry a little bit better. I think that as we take steps, right, think about just the nature of, I keep using the word expansive a lot, but just that nature of expanding. As we have experiences, we are exposed to something new and different. We learn about something through an experience. And what we're doing right now is kind of a product of where we are and what we've done in the past. But what we do right now moving forward will shape where we go. So when we experience something, then we learn about what's possible, what we like or don't like. And then if you were to talk to me 5 years from now and ask me about what I'm doing, I'll bet you I've pivoted again in the business and there's something a little different that I've, further specialized in or niched down into. And even how I got here, where we serve BIPOC nonprofit organizations, that wasn't what I was explaining to you 5 years ago. So that's what I mean. Like, just by nature of experience, we are learning and then taking next steps. So the path, our journey, does not have to be a straight line. For a few people, it's like that. But I think what I'm trying to do is take pressure off of students. You don't have to go from here to there in a very straight line. Like I said, sometimes it happens, but my path is more of a zigzag, and it still is zigzagging. I'm okay with that because that's how we're exploring. Most of the people I've interviewed on this podcast found their way into public health. There was a zigzag motion, or even if they knew they wanted to get into public health, they got into public health and then went several different ways because, again, public health is broad. So I think that we can embrace the zigzag pathways, right? But those are some of the things that really come to mind to me and how we can support public health professionals and encourage and attract more people to this industry. Because I think the idea that you don't have to have it all figured out when you graduate, but you can get in the door and get started, can be very attractive for the people who just really are wanting to explore and find out what's possible for them. Remember that public health overlaps so many industries, right? I think that can't be, I'm surprised in a very positive way at how many ways I'm being reminded of that. I'm constantly learning and hearing about the different ways that public health is overlapping other industries. That's exciting to me. I know that right now, my company, we're currently in conversations about these opportunities that lie at the intersection of public health and information technology. That's really fascinating to me, right? There's just so many possibilities. I think that's a very positive thing about public health, that the possibilities are almost endless. All right. As I begin to kind of wrap this up a little bit, and I think you're getting my message. I think you're understanding what I'm saying. In a nutshell, I really think that we can remove some of the pressure for students and early career professionals to have it already figured out, because there's no need to have it already figured out. Being in public health and knowing that that's where you want to be and being drawn to this profession is wonderful. I think that's good enough. It's wonderful. All by itself, it's complete. I think that for me, following my inspiration, my curiosity, I should say, following my curiosity has served me well. And I encourage people to do that. I've heard from guests on this podcast, multiple guests on this podcast, who have done the same thing, and it has served them very well. If we can encourage students, and I'm doing it right now, I'm encouraging students who are listening to this to follow your curiosity, follow what you're interested in, follow what inspires you, and see what happens. Sometimes you can lead down a path and you'll find out what you don't want to do, which is valuable. You haven't wasted a whole lot of time doing something that you don't want to do. You can follow that curiosity. If you don't like that, you can pivot and go in a different direction. Or maybe you're very successful. You're loving this. You're enjoying this. You're following this path. And then because of all of that, you get exposed to something very different and you decide to pivot because, oh, wow, now you've discovered this and you realize I can do this. And this takes me in a slightly different direction. And you continue to follow that path that has you so curious. And I think ultimately you can end up serving and having a great impact by doing that. Because when we're doing the work that we enjoy doing and we get to light up about that and serve with that level of enthusiasm and care and passion, and then the people we're serving are receiving that. It's not wasted energy. It's not falling on, deaf ears or poor soil. It leads to a very rich and rewarding journey and career. It has served me that way. And a lot of our guests, if you listen to this podcast, you've heard that. And I'm excited about what's coming next. I only know the next few steps on the path, so to speak, but that's okay. I'm open to seeing where we go from here. And I know that right now we are serving in a way that I'm proud of and that I'm enjoying. And I want that for others that are in public health, that are coming into public health, to just know my own example. I've just been exploring this journey one step at a time and being able to help and serve and have impact along the way, both as an employee for some organization and through business ownership as well. So I encourage you all to think about this, think about ways that how this has been true for you in your journey. Those of you that are, more seasoned and been on this journey for a while. And then those of you that are listening, and if you're students, maybe this is helping you to relax a little bit, then great. That was my intention. So as we begin to wrap up here, I really encourage all of you to share this podcast episode with a public health student that you know, or a group of public health students. If you're a professional in academia, or if you are just in your network, you have a group of public health students that could benefit from this, I just really encourage you to share it. And as well as early career professionals. We have a guide to this podcast for people who come to, because we have, this is episode 360. So there's a lot of podcast episodes to try to fish through, but we do have a guide where we've put a lot of the early episodes into categories, and we'd love to share it with you. It's an eBook. I think it's about, I forget how many pages now. We keep updating it as we have more and more episodes. So it's yours free of charge. So if you are interested in that, we'll provide links to it on the show notes page for this episode. And it's a great way for people who are new to the podcast to get acclimated and kind of get some of those older episodes, find out which ones to kind of start with in certain categories. So we'll have a link to that on the show notes page for you. So let me just tell you how to get to the show notes page. That would make it easy. All right. So I guess my big ask is for you to share this podcast with someone that you know, public health student or early career professional, and then guide them to the show notes page, because that's where they can opt in and get that guide if they're interested. And then any other links that, like those other episodes that I mentioned earlier, make sure that they're provided here as well. So the show notes page can be found by going to phecpodcast.com. And once you're there, navigate to episode 360. Which, side note, on a geeky level, I like the fact that this is episode 360, a 360 view. I wanted to come up with something clever to say around that, and I really couldn't come up with something, but I'm just going to tell you, I like the fact that this is episode 360. When you go to phecpodcast.com and just navigate to episode 360, you'll find the links that I've mentioned in this episode. Now, at the bottom of the show notes page, you'll also find social media sharing buttons, which make it super easy for you to share this episode with your network. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.